In order for us to be able to refill medications and enter medications for you, the first thing that we will need is a valid pharmacy. Once you log into your portal, and you'll see that we've logged into John's portal, once we log into John's portal, we can scroll down here on the right-hand side to My Pharmacies. I'm going to click on My Pharmacies, and you'll see the active pharmacies for John. We've got the primary pharmacy of Revolution Health as we dispense some medications here in the clinic, and then we have NextGen RX and Broken Arrow. We can click on this box right here that will make this the primary pharmacy for John, and so they will send a notification to us and we'll approve that so that that is your primary pharmacy. If you don't like either of those pharmacies, then you can click add a pharmacy right here, and you can enter a new pharmacy. We'll enter CVS, and we'll do this one here at 101st and Memorial, and then we can make that the primary pharmacy, complete and add. And again, it shows that this is pending, but it's going to ask for us to approve that, and we will certainly do that. Once your pharmacy is entered into your chart, then you can go to My Medications, click on that, and if you need to add medications, you can scroll all the way to the bottom and click Add Medications and just say lisinopril, and let's just say it's 5 milligrams daily for hypertension, complete and add. And so again, it's going to show this notification that we are trying to add this into our chart, and it requires the clinic staff to update that. If you want to look at your current medications, you'll see that John is on telmisartan 20 milligrams, and it, just for medical clarity, would not be on telmisartan and lisinopril, just for accuracy. But in this case, telmisartan is a medication, and I just added that medication to John's chart, so for the sake of illustration. And you see that no refills are available because this is an active prescription, and this one won't expire for 180 days. So if you are needing a refill on a medication, you'll see this refill request or request refill button for testosterone. So if John is needing a refill on his testosterone, click the request refill, and we do not charge our members for refills. Non-members will be charged a refill fee. This amount is not necessarily accurate, though. And then just put in any special instructions that you would need and submit a request, and you see that this has been sent to us, and we will review that and take care of that medication as medically indicated. So if you are needing a refill on medication, that is the process and the procedure for how to do that. We recommend against calling your pharmacy and asking them to send us a request, because we get inundated with refill requests for medications that don't need our intervention. So any questions or issues, be sure and let us know. That's how you add pharmacies to your chart. That's how you add medications to your chart. And you would add supplements to your chart in the same manner as medications. Thanks for watching. Hope this helps.